Now the management. So how will you manage? For management, I will do the screening for the other domain, take the focus history, and ear and hearing formal ear and hearing assessment. Refer to audiologist, ENT for formal hearing assessment, and neurological examination, reassurance, or refer. If it is needed, then we will refer, otherwise we will reassurance. Refer, we have to do refer to the child developmental center if needed, and we do the action by multidisciplinary team. Here the team members are speech and language therapist, maybe social worker if needed. So the role of speech and the language therapist. Evaluating and diagnosis speech communication and swallowing disorder, and treating also the speech hearing and the swallowing disorder, providing training, education to the family, caregiver, and other professionals, and give they can help in the developing of the sign language, and helping rehabilitation those who have experienced physical and psychological trauma. Okay, then so another recall question was that the role of audiologist versus the role of ENT. So audiologist mainly focused on hearing aid, auditory process, balance, and cochlear implant. And ENT, along this they have more specialized area, more specialist in other areas also, such as the rhinology, laryngology, sleep disorder, thyroid problem. One of the recall question was the indication for cochlear implant. If the child is less than 2 years, maximum 4 years, we can do the cochlear implant. And another question was indication of gomate insertion. If there is recurrent ASOM, so there may be needed for gomate insertion. And types of hearing loss: conductive type and sensory type, sensory neuronal type. So conductive type, rupture eardrum, impacted wax, and sensory neuronal types is the drug side effect, genetic disorder, head trauma, or meningitis, following meningitis. And other question, what may be the differential diagnosis of speech and language delay? It may due to hearing loss, may due to neglect, autism, global as a part of global developmental delay, physical issues such as cleft lip, cleft palate, cerebral palsy, spatial language impairment, oromotor dysprasia. And then examiner specifically asked at this age which hearing test will you suggest. So in neonate at the birth, we can do the evoked acoustic emission, and then 6 months to 15 months distraction test, and speech discrimination test more than 2.5 years, performance test 2 to 4 years, pure tone audiometry above 4 years. Pure has 4 letters, so above 4 years, and evoked at autoacoustic emission at the birth. So emission is out, so emission is coming out as we can imagine this coming out from the uterus, so it is done on the birth. So evoke autoacoustic emission. And in case of BARAS, that is the brainstem evoked response audiometry, here we can use this for autism, blight, and severe cerebral palsy and high risk neonate. And tympanometry we can do at any age. Thank you.